Hi, this is Dr. Christopher Maloney, Naturopathic Doctor in Augusta, Maine, talking about acne. Acne is something that you typically get in your adolescent years. More recently, I've seen a lot of women in their 30s getting acne and having acne. So what we see is with acne is actually acne has a range of reasons that occurs, but the primary one, the reason it shows up in adolescence, is because there's a sudden outburst of testosterone. And you say, well, but women get this. I'm like, yes, that's the point. Women have both testosterone and estrogen as well, and when that testosterone is in imbalance, it will actually cause the sweat follicles, the oil glands, to excrete lots more oil. That then provides a wonderful, nutritious snack for little bacteria that then get on our skin, and then the acne is our immune system's response to this bacterial infection on our skin. So a lot of the treatments are very topical, and they're basically killing off the bacteria. What I find fascinating about that is that you kill off all the bacteria and basically knock it down. 99.9% of all the bacteria are gone, but then you leave it open field. So you've got this completely cleansed vacuum, sterile field, and guess what? That 0.01% of the bacteria are going to come across and reinfect somebody. You also don't tell people to, not use the same jersey or something. So, the bacteria, they're putting the shirt back on and over their head, they're just reinfecting themselves with the bacteria. So the idea that you're using this kind of sterilization model is really not done very well. It's basically, hey, let's sell a bunch of product to people so we can keep putting them on, putting it on every day, because we're not really resolving the issue. If you want to resolve the issue, you look at it and say, well, wait a second, the average adolescent boy eats junk, so maybe he should eat something better. And the argument is, well, that's not been proven to cause acne, and chocolate hasn't been proven. And I'm like, whoa, let's hold up. So let's say that you can take one food and you're trying to chase it to acne. I'm like, no, of course not. But let's say you take a whole bunch of food, like this kid's just stayed up till 3 o'clock in the morning, is eating bad pizza in the morning, whatever. You give the liver that much more stuff to deal with. And what's going to happen is there's going to be a hormonal backlash. There's going to be basically the body's not able to handle all that garbage and deal with the hormones effectively and keep them nice and balanced. And so what you end up is having a little more testosterone, just a little bit more, and then the oil glands go nuts, and then suddenly you have more acne. And this can happen at any point. So when you start seeing it in women in their 30s, you start to wonder what's happening with their menses, what's happening with their periods, what's happening with the other hormonal things, because if that's the factor, then suddenly you have this situation where the body has to reset itself. The body needs to figure out some way to balance itself out. And then so topically you're not going to get where you need to go. What you need to do is go internally and start talking about what are the hormonal balances, what can we do to balance the hormones internally, and that's going to take care of the causative factor. And you can also just, one of the thoughts that was on the surface of the skin, well, wait, if you're wiping everything away, shouldn't you replenish yourself with good bacteria? People go, what are you talking about? Like probiotics, this is good bacteria. We use them all the time. They're yogurts, they're kefirs, and things like that. I don't necessarily mean applying yogurt to your face, but there should be a topical. It seems like the good topical things would have, here's the cleanser, here's the cleaner, here's the cover agent, and here's the good bacteria that you can then, in a nice, clear, in a non-greasy, moisturizing way, put back on here so that you're actually preventing that. So it's probably $1 million idea someone's going to steal, which is great. Please go use it. Go and help the poor kids with acne. Because the kids with acne are also the ones that are having the most hormonal changes. They're having the most active and troubling changes in their life. For the older women who have acne, I would say there's something happening hormonally. It's not something that you need to topically treat, and if you are topically treating it, you're just covering it over. You need to actually look at what's going on, and within that, to look at the diet that you're eating, because with hormones, there's a whole range of diet changes you can do. So, acne is something that can be treated internally more effectively than it's treated topically. The way it's being treated topically at this point is not terribly comprehensive. It's not going to resolve the issue long term. What will resolve the issue long term for most people is time. They will gradually work out of their acne. But for people who are taking things like tetracycline or the compound Accutane, these are medications for very intensive problems. And when you start giving them out for people who have acne, I really think you're misusing basically a shotgun to go after a mosquito. And I think that's a really bad precedent to set for people, because it tells their body, hey, you don't have to do anything to balance yourself out. We're going to use a shotgun on this thing. We need to start backing things off and saying, have you done all of the things that you needed to do before we give you this stuff? Not that you can't have it, but hey, let's look back. Let's make sure you're doing everything else, because this isn't necessarily the best thing for you. So this is Dr. Christopher Maloney, Naturopathic Doctor in Augusta, Maine, talking about acne.